Hello, I'm Dr. Aqsa Shaikh. I'm Associate Professor of Community Medicine at Hamdard Institute of Medical Sciences and Research, New Delhi, and I'm also the Nodal Officer of the COVID Vaccination Center over here. Today, we'll be answering some very interesting questions on COVID-19 infection. The first question is it true that COVID-19 is transmitted in cold climates and not in hot and humid climates? This was one of the hypotheses, but then we have had 2 summers since the onset of this pandemic, and we have seen that in every climatic condition, be it summers, winters, or monsoons, the COVID pandemic creates havoc, and therefore it has got no relationship whatsoever with the seasons. Is there any drug that can prevent and treat COVID-19? Well, as far as the prevention of COVID-19 is concerned, the only drug or thing that we have for it are vaccines. So please go ahead and take your vaccines. When it comes to the treatment of COVID-19, we do not have a cure yet for COVID-19 infection, but there are drugs available for symptomatic management, like for example steroids, antivirals, and also immunomodulator drugs. Only older adults and people with pre-existing conditions are at risk of infections and complications. Children cannot get COVID-19. Well, children are at lower risk as compared to the adults and those in the higher age groups for getting complicated, moderate to severe form of COVID-19 infection. But children do not have complete immunity against COVID-19 infections, and children can also get infected. And we hope that in the coming months, the vaccine will be approved for all children of all age groups. You have to be with someone for 10 minutes or more to catch the virus? Well, absolutely not. While spending higher amount of time with someone who is COVID-19 infected increases your risk of also acquiring COVID-19 infection, 10 minutes is by no means any kind of benchmark. So even 9 minutes of exposure for that matter can get you COVID. Rinsing the nose with saline protects against the coronavirus. You can protect yourself by gargling bleach. Oh my god. Can drinking alcohol prevent COVID-19? Well, do not try all these things at home, right? Bleach, alcohol, saline, or any of those materials do not protect you from COVID-19 infection, and they can be very, very harmful, sometimes even fatal. So please do not try this at home. Flu and pneumonia vaccines can protect against COVID-19. The virus causing COVID-19, that is SARS-CoV-2 or the novel coronavirus 2019, is completely different from the human influenza virus or from the other bacteria or viruses causing pneumonia in human beings. So while the disease may be similar, that is pneumonia, in all these cases, the agents are different, and therefore you need different vaccines against them. So no, the vaccines which are there for seasonal flu or the vaccines which are there for other forms of pneumonia are not going to protect you against COVID-19. If you get a COVID-19 vaccine, you will no longer transmit SARS-CoV-2 to others. Most of these vaccines are very potent and effective in preventing severe forms of COVID and in preventing deaths due to COVID. They are also effective in decreasing infection rates from COVID, but none of them are 100% effective in preventing infection, even asymptomatic infection in the vaccine recipients. So even after vaccination, you may be carrying asymptomatic infection, though the chances are much less, and therefore you need to continue to keep on taking COVID appropriate behavior like masking, hand hygiene, and social distancing. Can vitamin and mineral supplements cure COVID-19? Well, no, do not take excess of vitamin A, D, or C. These are not known to provide any kind of benefit when it comes to treatment of COVID-19. The same is also applicable for minerals like zinc. No, they do not have any specific role in COVID-19 infection. I've had COVID-19, so I am immune. Well, COVID-19 infection does provide you from immunity which may be lasting for 6 months or more. But by no means, one can say that since I've got COVID-19 once, I cannot get it again. We have seen people getting reinfected with COVID-19. We have also seen people having breakthrough infections after getting COVID-19 vaccination. So continue to keep your guard up and take all the necessary precautions even after you have got COVID-19 infection or taken a shot. A negative COVID-19 test means I'm not infected. Is that true? Well, not all the tests can have 100% sensitivity or specificity, which means that just because a test is negative, it does not mean that you do not have the infection or the disease. So no, that's not true. A negative COVID-19 test does not mean that you are completely free, though the chances of you being infected are very minimal. So it's very important that while we fight COVID-19 pandemic, we also fight the misinfodemic, which is spreading all across the social media platforms. If you have any questions, feel free to ask in the comments or in the chat boxes, and we'll be happy to answer them. Stay safe, stay healthy.